So a sleep apnea device, we would call an oral appliance for sleep apnea, really consists of this. We've got an upper jaw and a lower jaw. In this day and age, we scan and 3D print your models of your teeth. And normally we would have your bite looking something like this. What the sleep apnea devices do is that they open and move your lower jaw forward in order to increase the airway volume in the back of the throat. And they look a bit like this. This is an example of a sleep apnea device. They're usually in a two-piece arrangement, and that's the way they get locked forward. So one fits on the top teeth, one fits on the bottom teeth, and you can see how they're holding the jaw forward there. Okay, does give you a little bit of wriggle room forward and back just for your jaw joint and the comfort of your jaw joint. But that's basically what they are, reasonably comfortable to wear and can make a big difference for people. Well, dentistry can help with obstructive sleep apnea, mainly in the help to fabricate an oral appliance. So oral appliances for sleep apnea are devices that are designed to hold the mandible or the lower jaw forward to really increase the volume of air flow that's available in the back of the oropharynx or in the throat area. So they can certainly help a lot with snoring. They can certainly influence mild to moderate sleep apnea. There's a fair bit of evidence that they're not particularly indicated for people that are severe. And of course, always that getting diagnosed appropriately with a diagnostic sleep test, maybe even a CPAP machine trial. One of the big problems with the treatment of obstructive sleep apnea is that CPAP machines, which we know are very, very effective and probably the most effective way of treating sleep apnea, have a terrible compliance rate. They say that 35% of people can't wear CPAP machine or can't tolerate CPAP devices, even though they are quite successful. Whereas an oral appliance probably has a better compliance rate, but we do know that it doesn't quite work as well as CPAP either. So I think oral devices have got a terrific place for the treatment of sleep apnea and snoring, but we've always got to be mindful that they're not as effective as CPAP. But if you're sort of one of these people that can't comply with CPAP and you don't want to do nothing, I think they're a wonderful thing to consider. So the diagnosis of obstructive sleep apnea is usually, and I think appropriately, done through a sleep physician. So you would go and have usually an overnight sleep test, and a sleep physician would give you a diagnosis and really a guide on how mild, moderate or severe your condition is. The dentist can intervene a little bit, sometimes with our screening and sometimes with our discussions with our patients. We can sort of identify sometimes whether we think you're a candidate for sleep apnea by asking some very simple questions on, daytime tiredness, getting fatigued very easily, particularly when you stop. You might be, coming home from work and lying on the couch and you fall asleep straight away is usually a good sign that there's something not quite right. And of course, we all know now that obstructive sleep apnea is one of the big public health issues, and there's stacks of people that are undiagnosed with this condition out there. So our referral pathways usually are always through your GP and a sleep physician to get tested and diagnosed properly first, and then looking at treatment options secondary to that. So sleep apnea is usually diagnosed by people that are just perpetually tired. So we often find that, people falling asleep in the chair, they might be falling asleep in front of the telly. Some people are even falling asleep at the red light in the car. And, sometimes these things can get very, very serious. And it's usually a sign that you're not going through the proper stages of sleep every night. So the thing that worries the medicos and the big public health issues with this is huge incidences of cardiovascular events that come as a consequence to all this, and not to mention, mistakes and mishaps that happen because you're not sleeping properly as well. So, stroke, heart attack, we have a lot of with diabetes, and high blood pressure obviously can come as a consequence, because sleep apnea events, or those events where the airway does close, puts an extraordinary pressure on your cardiovascular system, so your heart and blood vessels, and it's sort of a bit like hitting the accelerator in the car 50 times a night. Things start wearing out faster. And that's the thing that we worry about with patients with sleep apnea in the long term.